Hey guys, and welcome back to my channel. This is Tricia here, and I thank you for coming to listen to my video. And I hope that you have been learning well from my content and enjoy my content. And if you are, I ask you if you would like my video and subscribe to my channel if you haven't so far, if you like the content. And also, if you would press the notification bell. It would notify you when I upload new videos. So today, guys, we are talking about maintaining professional boundaries and home care and making sure that we're not overstepping our boundaries, okay? So let's think about it, okay? You don't want to go into someone's home or have your caregivers go into someone's home and build a relationship outside of caring for the client in the proper way. Okay. So let's just say, you have a client that is very friendly, so on. And the caregiver, they're there day after day or however the care plan is written for them to visit and take care of this client. But this caregiver is there in an intimate space with just one-on-one. It may be just them and the caregiver in the house, okay? And they're spending several hours. So obviously they're talking, they're in the intimate space and so on. And you get to build a relationship, obviously, with this person. But from the beginning, we have to make sure that our caregivers have a streamlined care plan. They know going in how they're supposed to care for this client, what they're supposed to do for this client, and what they're not supposed to do for this client, okay? They need to understand what their role is as a caregiver and the things that they're not supposed to do. So that becomes part of your training. When you're hiring someone to work for your agency, you want to make sure that they understand what the boundaries are, okay? That they need to understand that they're not supposed to go into, if it's the rules for the house, not to be going in someone's fridge unless you're given the okay to do that, okay? Not telling dirty jokes and stuff like that to the client or the family member and stuff like that, and speaking out of context, okay? They need to be very professional with addressing them and being respectful of the person's home as well, okay? They need to make sure they don't get too emotional. So now, let's just say it's a hospice patient, for instance, okay? We need to maintain professionalism, have empathy, of course, and make sure that we show that we care, but not to take it above and beyond where they're reaching out to family members after hours. And it's just not professional to do that. They should be caring for that client while they're there. And when their job is done, their job is done. Not the client calling, or the family member calling the caregiver on off hours when they're not working, asking for favors, and them going outside and doing favors for this client when they're not on work hours. That is not the right thing to do, okay? Or doing personal favors for them outside of the scope of what they have on their plan of care, okay? That is important for them to also understand when providing care for your clients, okay? Now, we don't want to don't want to feel like we're cold, but yet still we just have to make sure that we are being professional at all times as well. We have to respect people's personal space, okay, by making sure we provide and keep things personal. We don't want to have our caregivers going home and having a full conversation about Mr. Larry and what happened at Mr. Larry's house today, or their family members. That's private information, okay? We're not supposed to go and discuss things that happen outside with our families or in the street and stuff like that, in the elevator and so on, about how they cared for this client had this kind of a wound or this kind of thing. We cannot do those things. So your caregivers need to understand that, okay? They need to refrain from having personal relationships with the clients. No one should be having intimate relationships. They have to have boundaries. No personal relationships. If there's an issue and they feel like things are getting out of hand or a little bit too personal, so on, suppose the person's coming on to them, they need to report that to you or the supervisor that you have managing your cases for you, to let them know that needs to be a conversation. They need to let the nursing supervisor or you as the administrator for your company let you know that they're feeling uncomfortable in a certain situation, okay, at the client's home. All right. So to avoid conflict, financial transparency from the beginning. You need to make sure upfront that you're providing a contract between you and the client or the client's family, whomever you are making this the plan for the care. At first, you should be providing some kind of a contract saying, okay, it's going to be Monday, Wednesday, and Friday, for example, from, let's say, from 8 a.m. to 2 p.m., Monday, Wednesday, and Friday. It's set. And these are the things that Sally is going to be doing for your mom, for example, on these days when she comes up. She's going to make sure that she provides a meal for her, that she makes sure that she provides incontinent care for her, blah, 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 on and on and on. But it needs to be written out so there's a clear understanding between you as the owner, your caregiver, right? And also for the client's family or the client, however that works, okay? Whoever the people are that are involved need to have a good understanding, okay, up front. There should not be any financial gain from getting a incentive for them giving you a referral or anything like that. That should not be happening. Okay, so we want to make sure that we follow all these things to make sure that we're not going out of boundary, that we're not having any conflict. That will help to resolve that up front. Just making sure we have things clearly noted and that we provide boundaries when we're caring for people, okay? I hope that has helped you guys out there. And I ask you to like and subscribe if you like my channel and the content that I'm providing. If you're thinking about opening up a home care agency, these are tips that I provide to help you, okay? So thanks again for watching my video. Please like and subscribe and take care of yourselves out there. Have a blessed one. Bye-bye.